looking forward to our next session. As I mentioned at the beginning of the program, one of our favorite startups founders and CEOs is Sanna Gaspard, and she is the founder and the CEO of Rubitection, which is a novel device that's focusing on the ability to detect bed sores before they actually appear on a patient. And of course, as you all know, and I'm sure you've been reading, these new types of fungi that are traveling around the U.S. now and being really becoming more endemic here in the United States, and the new infection levels that we're seeing, some of them again antibiotic resistant, are of great concern. So there's no more important time for a device like this than today. And so we're lucky to have Sanna joining us. Good morning, Sanna. How are you?
Good morning, Stan. I'm good. Happy Thursday.
Yeah, happy National Doctors Day. Thank you for joining.
No, my pleasure. And I agree with you. The best way to address an infection is to prevent the wound.
That's fantastic. So let's jump into it. Start, if you could, just for the audience. Again, it's a global audience, so just be sensitive that some of them may not have backgrounds in the U.S. healthcare system. What is Rubitection? Tell us a little bit about it, and how does it help the aging population?
So Rubitection is a health tech company. We are working on addressing a growing human healthcare problem known as chronic wounds that can range from diabetic foot ulcers to bed sores or pressure injuries, venous leg ulcers, conditions that traditionally affect the elderly, but from a bed sore perspective or a pressure injury perspective can affect anyone with limited mobility. So we're working on developing an AI-enabled platform that allows any user to track that wound from inception to advanced wound development, to have the data needed to develop data-driven customized care plans. And how we help patients and patients within the AARP umbrella is traditionally AARP serves people who are 50 years or older in the US, people who are the highest risks for some of these chronic wounds and poor healing are people who are 65 years or older. So really targeting the core of the AARP population and the core of the population as people age and need additional support and their skin breaks down, and trying to help people age safely at home or in a facility if they need additional support.
That's amazing. That's absolutely amazing. What a novel and important device, really transformational for sure. And again, no surprise that you're a Carnegie Mellon product. We're big fans of Carnegie Mellon. That's where Glenn DeVries, one of our favorites, came from. And just an amazing school of engineering and inventions coming out of there. But tell us, from your experience, what drove you to this? Where did you find the passion? How did your passion lead to this inventing and building this kind of tool?
Yeah, so I've always had a passion for healthcare and for innovation or engineering. So my background is, I have my doctorate in biomedical engineering, and my special focus in biomedical engineering is medical device development and commercialization. So for me, that was the way I felt that I could impact healthcare. You could be a doctor and you fix one patient at a time. You can make a device or a digital healthcare platform and help millions of people at one time. So that was really my passion. And I got into this problem while I was at Carnegie Mellon, actually, and learned about it through talking to a professor, and then from there turned it into my PhD project. I was really motivated by the fact that it was an area that was largely underserved from a technology standpoint, but it was affecting a large group of people. And it was also by virtue of the manual assessment technique, ended up being a health disparity for people of color, or inadvertently creating a health disparity for people of color. And I realized that technology could have addressed that, and I wanted to build that technology.
It's incredible. Good for you. What a great vision you had, and what a wonderful application of that vision to actually helping society. And obviously there's a lot happening in digital health right now, and you're aware of it. You're seeing it on a regular basis. And talk a little bit about that for a second. When you step back and you look at everything, not just Rubitection, why is digital health so important in today's society? What is it about digital health that is so important in our ecosystem, in our society around the world?
Yeah, I think The most important part about digital health is its ability to democratize care and access. I think that's becoming increasingly important for various reasons. One, that we're seeing more extreme weather conditions. So you have people who once had access who are losing access, where digital health can help bring resources where they're not currently available. But that's also true if you're looking at just remote or rural environments or developing countries. It's also, I think, really important now, impacted partly by COVID, that people want to be more empowered to manage their own care. And the only way you can do that is if you take the technology out of the hospital and into the patient's hand. And digital health is a huge part of that. So developing technology that's easy to use, developing technology that provides ongoing monitoring, and allowing technology that enables remote patient monitoring, where patients can be in their home, be more proactive around their care, but still get expert insight and diagnosis and treatment, will help refocus the whole healthcare system in the US particularly on value-based care. Because we're now allowing patients who are the most concerned about their health to focus on that prevention and early intervention. You can't do that without digital health platforms.
That's exactly right. That's spot on. What a great answer too. That's really inspirational. And when you look at your career and we look at what you're going to be doing with Rubitection and where you're going next, tell us a little bit about that. What are some of your ambitions over the next few years?
So I'm really excited about my vision. So my vision is my biggest vision is to really take this global. So, as we know, at a global level, the population is aging. Some of the birth rates are decreasing, and we are going to have a huge aging population with possibly insufficient amount of caregivers to care for them, where in empowering everyday people to have the expertise to do monitoring, to do assessment, and then to connect with a care provider remotely is going to literally save lives. And this is also particularly true for people of color. As we know, around the world globally, people of color are the largest subset of the population. Now, if you have a healthcare condition and a current clinical standard that doesn't even serve that population, the majority of the people in the world who are all going to age, I'm really excited about solving that problem and bringing that technology to global markets. So, for example, we've talked to a hospital in Brazil who was excited about what we're doing. We talked about to a hospital in Africa and Ethiopia who was like, we need it now. Like, we have patients, we need a way to monitor it. And also very similar when we were in India. So it's clearly a global health problem, and it's a growing global health problem where there's a desperate need for technology. And we're really looking and really excited about solving that problem and bringing our solution to the global market and finding the right partners to do that. So, if anyone's interested in partnering with us for testing or for financing to fund the company, or even just to give us some feedback, we would love that. We're looking to work with, additional partners.
That's so exciting. Well, that's just wonderful. And thank you, Sanna, so much for your leadership in the ecosystem, and certainly for your tireless efforts in building this technology and scaling it at the levels you're bringing it. Thank you.
Thank you. I appreciate it. Thank you for the time today.